This House is now in session. Minutes of the meeting held Friday, the 19th of October 2018. In relation to those said minutes, I'm not yet in possession of those minutes.
I therefore beg to move that those minutes be deferred.
The question is that the minutes of the meeting held on Friday, the 19th of October 2018 to be deferred. All those honourable members in favour, please say aye. Those against, please say no. I think the ayes have it. The aforesaid minutes are deferred.
Announcements by Your Honour the Speaker. Messages from Her Excellency the Governor General. Petitions, papers, government notices, private members' notices, notices of questions, reports from select committees, first readings of bills, statements by ministers, congratulatory and/or obituary speeches, personal explanations, motions for leave of absence, oral replies to questions, notices of motion for the adjournment of the House on matters of urgent public importance, orders of the day. Senator.
Mr. Speaker, I beg to move that standing orders numbers 6, 16, 18, 20, 42.5, 43 and 44 be suspended for the remainder of the day's sitting.
Question is that the aforementioned...
Second, please.
Make second that.
Question is that the aforementioned standing orders be suspended for the remainder of the day's sitting. All honourable members in favour, please say aye. Those against, please say no. We think the ayes have it. The aforesaid standing orders are so suspended.
Government business. Order number 6, sir. In the name of the Honourable Minister in the Ministry of Finance and Economic Affairs, to move the second reading of National Insurance and Social Security Amendment and Validation Bill 2018.
I remember Mr. Mike Christchurch, East Central.
Mr. Speaker, I stand to submit the bill that would amend the National Insurance and Social Security Act, Cap 47, to provide for the imposition of a health service contribution and to validate the purported payment and collection of the health service contribution from October 1st. Mr. Speaker, as you are aware, and the rest of Barbados, the Prime Minister, the Honourable Member for St. Michael North East, in her budget presentation of June 11th, would have proposed the introduction of the health service contribution, which would seek to assist with the financing of the provision of health care at the Queen Elizabeth Hospital. And as Barbadians, sir, we are all too aware as to the state of health care in this country. We know, sir, that the quality has diminished over the years, sir. And this government, sir, has taken the responsibility for ensuring that as we go through this very difficult moment in time, that the people of this country should be able to rely on a good quality health care provision in this country. And in so doing, we would have analyzed, sir, what would have been provided by the previous administration, and we felt that that the QEA specifically, sir, needed to have clarity with respect to their financing, such that the people of this country can access a quality of health care that they've grown accustomed to. And so this bill this morning, sir, seeks to not just bring a measure of financial certainty to the Queen Elizabeth Hospital, but certainly, sir, it demonstrates the importance that this government plays, the importance of the role healthcare, sir, plays in the development of a country. Sir, the previous administration, and I must point out through you, sir, to the country, that over the past few years, a lot of taxes, sir, were introduced under the guise of seeking to finance healthcare at the Queen Elizabeth Hospital. And on each of those occasions, sir, Barbadians paid their taxes, and those monies never found their way to the QEH, sir, to the point now where, sir, Barbadians have witnessed what has become a deterioration in the quality of services that was provided, not just at that institution, but certainly across the healthcare system. And I know that the Honourable Member for the city will elaborate a little further on this. But we feel, sir, that it is important that Barbadians understand that in order to provide the quality of healthcare that they need, that the government has a responsibility to make sure that resources are made available, but even further, sir, that the resources are spent in a manner that befits the taxpayer of this country. And so this amendment this morning, sir, seeks to do a couple of things which will make it easier for the financing of healthcare at the QEH specifically, but certainly, sir, allows for that certainty of planning on the part of the medical profession, and certainly in the context of the Ministry of Health as well, with respect to be able to manage the healthcare system in this country. And so, sir, the healthcare contribution, as the Prime Minister stated in the budget, seeks to have, through the National Insurance Scheme, sir, the collection of 1.5% of insurable earnings to be paid by employers, 1% of insured earnings to be paid by employees and self-employed persons to be collected, sir, by the National Insurance Board, which will then be transferred, sir, to the Queen Elizabeth Hospital. And the reason that this is important, sir, is because, as I said earlier, there were several instances in the past, sir, where taxes were imposed upon Barbadians under the guise of making provisions to the Queen Elizabeth Hospital, sir, and those provisions never found their way there. And so this specific bill, sir, this specific bill will seek to ensure that monies collected under this health service contribution, one, will not go into the consolidated fund, but the National Insurance Board, when they collect these monies every month on the part of employees and every quarter, sir, on behalf of self-employed persons, that those monies will be transferred, sir, directly to the Queen Elizabeth Hospital to ensure that the hospital, sir, can provide the quality of service that we would expect as Barbadians, having made the contribution. And it's important, sir, that we distinguish ourselves from that which went before, because we will not collect money, sir, under any false pretense, but certainly we will not, sir, seek to do in any way that which was done before. The responsibility, sir, the responsibility with respect to how these monies now will be delivered, sir, will fall squarely on the mandate of the board of the Queen Elizabeth Hospital, obviously following the policy directive of the Ministry of Health. But, sir, we are at a juncture now where we have to scrutinize everything that we do. And so, therefore, even as we are seeking to provide these finances, sir, very shortly, as we will do across government over the next few years, is that we will be conducting, sir, what we call public expenditure reviews. Because even as we have provided more resources, we must ensure that the resources being provided, sir, to the Queen Elizabeth Hospital in this instance, but certainly as government provides resources for any public good or public service being provided, sir, that we ensure that there's value for money where the taxpayer can understand what it costs to provide those services, and those who are receiving those services, sir, can determine what the quality of those services might be. And so, sir, this bill is an important piece of legislation because it speaks to a measure of financial responsibility. And as we move forward, sir, yes, there will still be transfers to the Queen Elizabeth Hospital in the normal way, but as we know, sir, and as we have said for a number of years, the monies allocated annually in the budget, sir, for the Queen Elizabeth Hospital were always about 25% short of that which was required to provide the services at the QEH. And so even though in this measure, sir, this health service contribution, which is going to be administered through the National Insurance Board and delivered directly to the Queen Elizabeth Hospital, as we do that, to fill that gap, sir, as I mentioned, we will now go through an exercise to make sure that we understand exactly how monies are being spent to ensure that Barbadians can get the highest value for money. Now, sir, this bill seeks to repeal and replace sections 20A of the Act. And section 20A, sir, says the health service contribution, and it says they shall be payable in respect of every person to whom section 12, 12A, 13, 13A, and 14 relate. A contribution to be known as a health service contribution at such rate as may be subscribed by the regulations, as I mentioned to you, sir, 1.5% for employers and 1.0% for employees and self-employed persons. We are amending section 20B, sir, to state specifically, and I want to read it explicitly, sir, that where it says, contributions collected under this part, sir, shall be paid to the Queen Elizabeth Hospital. And that is important, sir, because as I said before, when we say that we're going to do something, sir, we bring the appropriate legislation to give effect to that, sir, so that persons will know that when monies are deducted from their salaries or when they make their contribution of self-employed persons, that they know that they will be covered. And I want to reiterate something here, sir, because it is something that it is absolutely critical. Because I wish to remind the country through you, sir, again, that whilst we are talking about national insurance and the administration of national insurance, sir, that for the past 3 years, up until we came to office in May of this year, sir, the government of Barbados was not paying national insurance contributions for public servants in this country, sir, to the tune of almost $300 million. And so as we seek to bring regularity to what we are providing to the QEH, sir, the government of Barbados, as we have done under the framework with respect to the debt restructuring and the Barbados Economic and Recovery Transformation, sir, we, this government, sir, will be paying to the national insurance over the course of the next few years those arrears for public servants, sir, in addition, sir, to what it will now cost the government to keep current going forward with respect to provision of this very health service contributions for public servants, sir. And the reason, sir, is simple. as an employer, or I should say as a responsible employer, sir, the government is the single largest employer of anybody in this country, and we have to lead by example, sir. And as we go forward, sir, we intend to make sure that every public servant, that if they fall ill, sir, that they know that if they go to the QEH, that there will be a service provided there for them, sir. Because when people work hard and pay their national insurance, sir, and is deducted from your payroll, sir, it should be paid. It should be paid. And the government, sir, is no different to any private entity, because there are penalties to the private sector when such does not take place. But we, sir, in the government, as I said, must set the example to ensure that when we say we're going to do something, sir, that the private sector understands the standard to which we intend to set for those to follow, sir. And we cannot in any way, sir, as we go through this period, leave people behind. And so therefore, every single Barbadian must be aware that the government of Barbados will be paying the arrears for national insurance contributions for the public servants, which they work, sir, and they deserve to be covered. But going forward, sir, we shall be current with respect to not just the national insurance contributions that are currently due, but certainly this health service contribution, sir, which will now come on stream effective October 1st. Now, sir, as we know how national insurance works, the 15th of every month, the month following, national insurance contributions are due. Everybody in Barbados knows that. Every employer in Barbados knows that. For self-employed persons, sir, at the end of the quarter, it is the 15th of the following month after the quarter. And so therefore, the first contribution, sir, that will be collected, or to be paid, will be November 1st. November 1st. And so as we are in October now, sir, and I must bring to your attention, because as it says, it is also a validation bill, sir. And we are indeed in October. But I just want the public to be aware that obviously the provisional the Provisional Collection of Taxes Act, it would have expired on October 11th. But of course, you know, we have been busy with other pieces of legislation coming to Parliament. And so we are bringing this to make sure that every legal authority, sir, is in place to make sure that the government can legally collect that which we are supposed to collect. And there will be more legislation to come to Parliament soon, sir, to make sure that we can make sure that all the monies that we are collecting will be done in a legal manner, sir. Now, sir, Section 20D of the Principal Act is repealed and the following substituted. And it says this part shall come into operation on the 1st of October 2018. And of course, sir, the consequential amendments at Section 5, as you can see, as I indicated earlier, are already outlined with respect to the percentages relating to how much employers pay, which is 1.5% of insured earnings and 1% for employees and self-employed persons. What I must also indicate to the country through you, sir, is that as a result of that 1% change for self-employed persons, the first schedule, as it says, delete the words 15.5%, which will now be replaced by 16.5%, which means that for self-employed persons, that 1% now increases their contribution with respect to what they will pay to 16.5%. The validation, sir, and it says, notwithstanding Sections 3, 2, and 5 of the Provisional Collection of Taxes Act, the health service contributions purportedly paid and collected from the 1st of October to the date of commencement of this Act are deemed to have been validly and lawfully paid and collected. Sir, whilst this may seem on the face of it, a minor adjustment to the contributions that people will be making with respect to their national insurance. We give the country the assurance that, one, we will continue to manage the resources of government in a manner that they have grown accustomed to under previous administrations of the Barbados Labour Party. But certainly, sir, we cannot rest on our laurels in any way. We now want to pivot, sir, and provide for Barbadians a quality of health care perhaps they've never seen in Barbados before. And it's important to recognize that as we transition to take advantage of what we have built up within the public health sector in this country. Because Barbados has always been known, sir, for having good, very good, sir, capacity within the public health space. And so once we're talking about how we're going to finance the Queen Elizabeth Hospital now, sir, and we have always looked at healthcare as a social compact or in a social context, Barbados now has to pivot, sir, and leverage that capacity that we've built up within the healthcare space in order to leverage that as part of our global outreach, sir, whether it is in medical education or medical tourism. And so as we move forward, sir, we want to make sure that when we embark on those kinds of ventures, sir, that Barbadians will also see commensurate with that expansion in that space, sir, the level and provision of other services that are not necessarily currently available on the island, but by leveraging the capacity that we already have in that space and bringing expertise onshore in a real sense, sir, that this country now can leverage what we have within the public health space and to now be able to compete globally, sir, whether it's in medical tourism, medical education, within the sphere of medical transcription, sir, because it is this transition, sir, this transition which is also going to help us to improve the quality of healthcare provision on the island. Because with the best will in the world, sir, we can't do every single thing that we would like to do at the Queen Elizabeth Hospital. But this government understands that we have to balance what we are doing at the QEH, balance how we are going to expand the economy with respect to the provision of whether it's medical education or medical tourism, sir, bridging those services that will be provided in those two spheres, not just to bolster what is happening with the provision of healthcare at the Queen Elizabeth Hospital or even the polyclinics, but to have a system, sir, that is integrated in a way that sees the provision or the enhanced provision of health services for Barbadians going forward. And so this, sir, is just a part of the strategy, in a sense, sir, to pivot and leverage on what we have already. We know we have some work to do within the healthcare system, sir, to rebuild the confidence that persons once had in that space. And it starts, sir, with just making sure that the adequate resources are immediately available to bring the standards back to where we know, sir, they used to be. And that is going to be very important, sir, and I know that the Honourable Member for the City has been working very hard to bring some order back to the state of affairs within the entire health system. And we are just trying to make sure, sir, that we give the appropriate resources to be able to help aid with that. And so, whilst, yes, sir, we acknowledge that this is an important undertaking, what we ask the public, sir, to do over the course of the next few years, we want the public, sir, to judge the difference. Judge the difference. Because we are not collecting and putting in the consolidated fund as the previous government did. The monies are going directly to the QEH. So, as the Prime Minister has always said, sir, judge us on the performance, sir, on the performance. And so, therefore, I know, sir, that the management of these resources now will become very, very critical And the engagement, sir, of the public, I would anticipate, sir, will also be very critical. But we know what needs to be done, sir, and we are going to provide the resources in part to get them done. But at the same time, sir, there will be other reforms that will come on stream going forward because, sir, we simply cannot do that which we were doing before. Things have to change, sir. Processes have to change, sir. And there are things that are going to be happening, sir, that we will engage the public on very widely, sir, because we can't spend money the same way in 2018 as we were spending in 2000, as we were spending in 1980, sir. So as we move forward, sir, the way that we provide, whether it's health, in this instance, healthcare services, sir, things will change, and I'm sure the honourable member at the appropriate time will indicate to the public, sir, what some of those changes will be. But, sir, this is a recognition, sir, that, one, it is not business as usual. So when we collect money, sir, it has to go where it is intended to go. And this bill, before this House, seeks very much, sir, in keeping with our philosophy, sir, of making resources available directly. So this is just consistent, sir, with what we said with the garbage and sewage contribution with the Sanitation Service Authority. We brought that legislation here, sir, specifically to deal with that, sir, and that is in place. This health service contribution, sir, is following on in the same vein, sir, with once you impose a particular tax or levy, whatever you wish to call it, sir, that it goes where it is supposed to go. And that, sir, I believe will be the hallmark, sir, of accountability, because then we can go directly, sir, to the agencies, and the public, sir, and the government can hold these agencies accountable, sir, because the appropriate resources are being made available for them to be able to execute their mandate. Now, sir, we are still in a transition phase, and so as I said, the first payment of the health service contribution is due on November 15th. At this particular phase within the context of the Ministry of Finance, we are still making the regular resources available to the QEH over the course of the next quarter as these monies come in, and then obviously as we go forward, certainly within the context of the budgeting process, we will be in a position, sir, to make sure that come next financial year that we, one, make the appropriate provisions within the context of the estimates of revenue and expenditure, whilst also having a monthly contribution coming from the National Insurance Board directly to the Queen Elizabeth Hospital. And, sir, these amendments to before the House today, as I said, is just consistent with what this government intends to turn a new page with respect to the administration of the public finances. And with everything that we are seeking to do, sir, in terms of restoring confidence within the economy, restoring trust with taxpayers, sir, in terms of how monies are spent, this is but just another part, sir, of the demonstration of leading by example. And I want, sir, to put before the House that this National Insurance and Social Security Amendment and Validation Bill is a critical part of how we transition, sir. Transition the way that we currently provide healthcare services to the public, because we know what value public health has within the context of an economy. Because, sir, whether we like it or not, if people cannot get the appropriate care that they need, it not just disrupts the family unit, it disrupts the workplace, because obviously if people being out for prolonged periods of time of illness, productivity diminishes. And so therefore, sir, we feel that as we move forward, we have to look at the provision, sir, of healthcare in a holistic way, because it is that provision, sir, and the quality of healthcare that is going to be critical to ensuring that we can leverage that which I know we can leverage within the expansion towards engaging in medical tourism services, as well as in medical education services. And so, sir, the health service contribution will come into effect from October 1st, and once again, 1.5% of the insurable earnings to be paid by employers, 1% by employees and self-employed persons. And so, sir, this is just part of the overall restructuring of the way that the public finances are being managed. It is part of what we intend to do to make sure that once the public expenditure reviews are undertaken, that we can come back certainly to this House, sir, through the consultation with not just with the Ministry of Health, but as I said, across government, such that we are in a position, sir, to give the public every measure of accountability that we can deliver, until such time as we can bring other legislation, sir, that allows the public to be able to directly either request information or to get reports on a much more regular basis. And so, sir, I just want to say that the bill would amend the National Insurance and Social Security Act, Cap 47, to provide for the imposition of the health service contribution and validate the payments and collection of health service contributions from October 1st. Sir, we know that things are going to get a little rougher, sir, before it gets better. And since we are talking about health service contributions, sir, when you're ill and you need to go to the doctor, sir, and the doctor prescribes a particular course of action, sir, in order to get well again, sir, it is important that you follow the doctor's advice. And this particular measure, yes, will take a little more out of persons' paychecks, sir. We acknowledge that. But fundamentally, sir, it is the provision, sir, of the services in the national good, sir, that is important. And so therefore, sir, the health of a nation, sir, the health of a nation has to be the health of the economy. And I know, sir, I acknowledge it fully, that as these measures start to take effect, sir, that we are well aware of what currently exists, sir, within households in this country. But it is important, sir, that as we move forward, that the public recognizes that the value for money that we are talking about with respect to what is being provided, sir, is critical, sir. Critical to ensure that any one of us, any of our family members, sir, that if they get ill, we must ensure, sir, that they have the appropriate level of care available, sir, available to attend to the illnesses that will befall any of our loved ones, sir. And whilst at this point in time, sir, as we move deeper and deeper into this adjustment period, yes, there's a recognition, sir, that this health service contribution will have an impact on the take-home pay of persons. The reality of this, sir, is the health of the country, sir, collectively is very, very important. And so what I would wish to indicate, sir, is that we are prepared, sir, to be held perfectly accountable. Sir, perfectly accountable. Because having made the monies available directly to the creator, sir, the mandate now is to ensure, sir, that the quality of services that are being provided within the healthcare system, sir, the quality is improved. And I think, sir, it is on that basis that I would want to say that this measure of sacrifice, sir. This measure of sacrifice is important as we seek to raise the bar, sir, not just for the provision of those services, but as we seek to pivot, sir, as I said, and take advantage of those opportunities that we have with respect to medical education and medical tourism. Sir, the reality, as I said earlier, we cannot provide every medical service on island. But we can lift the standards, sir, of the operations of our health facilities, such that as we bring or attract new entities on shore, sir, to engage in those services, that we can integrate, sir, to ensure that there's a better quality overall, sir, of services available, a wider cross-section, sir, of services available to the public. And it is that, sir, that in that context, that I would like to place, sir, not just this health service contribution, but certainly as we move forward with respect to the provision of new jobs, certainly in those areas, sir, that we not only look at healthcare as a social good, but also as a progressive economic good as well, sir. And so, with those few words, sir, I want to submit this National Insurance and Social Security Amendment and Validation Bill 2018 to the House, and say, sir, that I fully support this measure, because I believe, sir, it will provide not just the appropriate resources, but the transition, sir, the impetus to adequately transition and take advantage, sir, of that long history of capacity that we've built within the public health sector. And it is that, sir, that I believe that we must leverage, not only to improve the quality of health services to the public, but certainly being able to build up a different sector, a new sector, and be able to compete globally. And sir, with that, I wish to move the second reading of the National Insurance and Social Security Bill 2018.
The Honourable Member for the City of Bridgetown.
Thank you, Mr. Speaker. I rise to make my contribution to this bill, a bill which seeks to provide the legal framework and authority that would facilitate the collection and the disbursement of the funds to be derived from the health services contribution. And I want to thank the Honourable Minister of Finance, Economic Affairs and Investment, the Honourable Prime Minister, for the foresight in allowing these contributions not to go the traditional route of the consolidated fund, but to go to the National Insurance Scheme so that they can then be disbursed to the Queen Elizabeth Hospital to do exactly what the contributions are intended to do. And this is very important. I would like for Barbadians, all of us who live here, all of us who call this country home, not to see this health service contribution as an imposition, but really as an investment, because each and every one of us who make this contribution, we are investing in our health care and the health care of our children, our grandchildren, our families, and our loved ones. And it is not that this government wants to take taxes out of the pockets of ordinary Barbadians. It is because we have a responsibility to the people who elected us. And we were elected by the people to serve the people. And part of that service is the provision of high-quality universal health care. But why are we doing this? I will give you a few valid reasons. The Queen Elizabeth Hospital, I believe, was opened on the 14th of November of 1964. And this hospital was opened in order to address medical, surgical, clinical, and treatment needs of Barbadians, and also to provide facilities as a teaching hospital for those Barbadians who were interested in pursuing careers in the medical profession. So we are dealing with a plant, a physical plant that is over 50 years old. A physical plant that is providing a much wider variety of services, medical services to the people of Barbados than were provided when the institution was constructed, and perhaps even beyond what might have been envisaged at that time. And as a result of this, what we've seen over the years is that the physical structure had been tampered with in order to accommodate and to facilitate the expansion of the services provided, and sometimes this has not always been for the good in terms of the actual structure of the hospital. And also the variety of services that are offered today also means that we have to pay a lot more for the services that are being provided. We also have a situation where the incidence of non-communicable diseases have been rising at some alarming rates. And the socio-economic impact of NCDs on our society and the psychosocial impacts on our citizens and the significant amount of the health budget that is required to provide health care for these Barbadians who suffer from these diseases, this continues to be a challenge, not only on the health budget, but on the national budget. And so this also creates a challenge for us. Successive Barbadian governments have always invested heavily in our human resources. And this is evident certainly in terms of the size of the budget that is allocated to health and the budget that is allocated to education. But because of the challenges that we face in terms of providing universal, high-quality health care, all of those gains made can be eroded if we allow these challenges to overwhelm and to overcome us. And it would be a dereliction of duty on the part of this government if we did not take action to change this situation. And that is why we have decided to go this route of asking Barbadians to make a contribution towards their health care. And I want to say to all Barbadians that there's a saying that the health of a nation is the wealth of a nation. And I want to say that a small contribution from each and every one of us towards the health of this nation will result in a significant contribution to the wealth of this nation. The Barbados Labour Party government on assuming office recognized the challenges and the difficulties. And from early on, the Honourable Prime Minister decided to redesignate the Ministry of Health to that of Health and Wellness. And that, as the Honourable Prime Minister would say, was not by accident. Because we believe that we have to tackle these issues in a two-pronged attack. The first one being preventative, because it is the preventative interventions that we are going to be introducing and that we've started to introduce that we believe in the long term will pay dividends. And then we should start to see a decrease in the curative responses that we are currently making in order to deal with the problems that afflict our population at this point in time. And that is why we've launched the Wellness Initiative, and soon from now we will have a wellness strategy and wellness policy. But these things will not show immediate results. The health services contribution, on the other hand, will show some immediate results. And I want to say to those of us who are involved in healthcare, starting with the Minister of Health and Wellness, whose responsibility it is to provide a level of leadership that is required to get this health service going in the way it's supposed to go. And I hold myself accountable and responsible to the people of Barbados. And I want to say to all those who are with me in this fight, those at the QEH, that these contributions must now be translated into providing a higher quality of service to the people of Barbados. As a result of these contributions, the Queen Elizabeth Hospital will now be in a position to plan properly and comprehensively to tackle and deal with the problems that exist today, and to certainly plan for those problems that we know will hit us in the future. And by providing this kind of funding, it means that they are assured of at least a quantity of money every month that they can plan with in terms of refurbishing the old equipment within the hospital and providing better facilities for all. And I want to say that to whom much is given, much is expected. But I also want to say to Barbadians to demonstrate some more love and kindness towards those who work in the Queen Elizabeth Hospital, because one bad apple does not spoil the whole box. And there are people within the health services system that work extremely hard, and I've seen a number of them at work. Our nurses who are now involved in the Caribbean Nurses Organization conference here in Barbados, with over 300 nurses coming from the region and beyond, they work very hard indeed. And yes, I agree that we have to do something, and we have started to at the QEH in terms of correcting some bad attitudes, because we all have to live in this country, and we do not know when it will be our turn or our children or grandchildren to go to that facility and to be cared for and provided for by those healthcare professionals. And so we expect and we will deliver a higher quality of service to this country, because we now have the resources to make that possible. But it does not end there. It does not end there, Mr. Speaker, because there are some reforms that are required within the Queen Elizabeth Hospital and the health services system in Barbados that money cannot buy. And we have started to work on some of those. And so I'm very happy to report the Honourable Member who introduced the bill indicated that by the 15th of November, the first set of funds should be forthcoming as a result of the health services contribution. And I'm also happy to report that certainly by that date that there will be some new initiatives at the Queen Elizabeth Hospital that will reduce significantly the length of time that people have had to wait at the QEH to get certain things done, and that will improve the quality and the delivery of service to the average Barbadian. I'm talking, for example, about an additional triage station that will be established by then, and this one will be a physician-led triage station that will reduce the time from the time you arrive at the door until you are seen by a doctor. This will be in place by then. Very importantly, there will be the establishment of a minor cases unit at the QEH. And once you go to triage and it is determined that you are not an acute case patient, you will then be transferred or sent to that minor cases unit, which will see you, which will treat you, and which will then either allow you to be discharged if that is the situation, or if you have to be admitted, you'll be admitted from the minor cases unit. What that does is it relieves people of having to spend all of these hours waiting because they're not acute cases. And that is going to reduce the burden on the accident and emergency department, and also the length of time that people have to waiting to be seen at accident and emergency. The third aspect of improvement has to do with the establishment, which will be by then as well, 15th of November, of a discharge lounge at the QEH. What do I mean by a discharge lounge? We have situations in which a number of patients would have been discharged officially by the doctors, let's say in the morning, but they have to wait. They have to wait in order to get medication or whatever, or they're waiting on relatives, and they're actually in the wards, in the beds, because that's the only place that we have at the moment for them. And then that is taking up bed space, critical bed space that is required for the entire hospital and also from the accident and emergency department. And that will be implemented shortly, and that is going to bring a measure of relief. There will also be the establishment of an observation ward to complement and supplement what is being done at accident and emergency. And what is this going to do? We have situations where people come into accident and emergency. Yes, they're seen by physicians, they're given medication, or they have to have x-rays and other things done. They have to be observed before the determinations can be made as to what route they're going to take, where they're going to go. And they also occupy beds that are already in short supply at the accident and emergency. And that accounts for the problem that you have then with getting ambulances, because when the ambulance team is bringing people on stretchers and there are no beds available, the persons then have to remain on the stretchers, which then make the ambulance. Yes. So, the observation ward then will alleviate these problems, where persons now will be sent to an observation ward, those persons that I just described, and thereby creating further room within the accident and emergency department. Then the question of patient advocates. Yes, the hospital does have patient advocates, but we need to do some retraining with them to make them more effective, because they are the persons who are expected to interact and interface with the general public and to make life easier for persons who utilize the facility. And this is one area also that we will see some improvement. So these are the things that are taking place at our lone public tertiary institution. The other thing that we have to be cognizant of is the fact that the Queen Elizabeth Hospital, as it is not climate resilient. And in the near future, we have to start piece by piece, block by block, trying to create a climate resilient, smart, public tertiary hospital. That is QEH. It's going to take some time and it's going to take some money, but it's a direction that we have to go in. And that is so because in places like Dominica, for example, who were in similar situation to ours, after the impact of the hurricanes in Dominica, the hospital, the major hospital in Dominica, could not provide the level of services that were expected. And that is something that we have to guard against. And so, I certainly support this amendment bill, validation bill. I support it, yes, as Minister of Health and Wellness, but I support it, I will say more importantly, as an ordinary citizen of this country who recognizes the fact that if we do not go in this direction, that there are going to be serious, or there will continue to be serious negative impact on our population, on productivity, on our ability to rise above as we have done before. And we cannot afford to let that happen. We must be able to say again that we are the #1 developing country in this world. We have invested heavily in our people, and that is the reason why we've had international acclamation in terms of health, in terms of education, in terms of longevity, life expectancy, in terms of GDP, in terms of quality and standard of living, as indicated by the United Nations report for several years, which listed Barbados as the leading developing country in this world. But we cannot and must not, and this government certainly will not, walk away from our responsibility and our duty to the people, even if there has to be a little bit of bitter medicine. We are confident, absolutely confident, that we will bear fruits in the end from the actions that we are taking today. And I want to say to Barbadians in closing, you elected us to do this job, and we intend to do it. Walk with us, hold our hands. Things are going to be tough, yes, but we will get through this. And within 2 or 3 years, Barbados will return to a level of prosperity, and this Barbados Labour Party government will be able to take this country based on that foundation to a place where no other government has been able to go before. I am confident in that. And so should you. And with those words, Mr. Speaker, I indeed am obliged.
The Honourable Member for St. Michael West.
Thank you, and good morning to you and all honourable members. Mr. Speaker, the honourable member for Christchurch East Central is usually very precise and clear in his submissions. The fault may lie with me today, but it would seem that there was a little bit of ambiguity conveyed in the presentation, leaving at least me a little bit confused. And what appeared to me to be apparent ambiguity may in fact have been inadvertently rendered by the honourable member. But it was not clear to me by the end of his presentation. They were talking about a collection of a levy, a tax, which commenced on 1st of October, or which is to commence 1st November, or both, because it seems to me that he indicated either 1st October or 1st November, or both those dates, and therefore I'm not sure. But perhaps, and that's something that can be easily corrected when he wraps up the debate, Mr. Speaker. Perhaps the broader point, though, is that it is unfortunate that a government so equipped, not only in terms of the numbers, but in terms of the quality of its principles, the ministers, continues to bungle, is the word which is popularly being used these days, in its efforts perhaps to get things done rather quickly. It is not necessarily taking the requisite care to ensure that things are done as properly as they might be done. We've seen that with reference to initiatives at the Ministry of Public Works and Transport more than once. We have seen it with reference to the appointment of senators at the outset of this parliamentary session. We have seen it with reference to the treatment of pensioners relative to the debt restructure of recent date. And the constant having to come to a point, then pull back and come again to get it right is what I am referring to. And that is unfortunate. I think in this instance, we're seeing it with reference to this bill before us. The Honourable Minister of Finance on, I think, the 11th day of June, introduced some taxes inclusive of this particular one. And therefore, there was every indication that legislation would be coming, a bill would be coming to this Parliament so that the necessary legislation could be put in place to support the collection of those taxes, the collection of this levy as part of our national insurance contribution. And yet only now, the end of October virtually, is this legislation coming. Now I question the procedural aspects of the matter. If you look at the Provisional Collection of Taxes Act, Cap 85, early up in that piece of legislation, Mr. Speaker, under Section 2, it refers to taxes and how they're collected and disposed of. It includes all assessments, charges, duties, fees, rates, impositions, and other levies, however they are called, the proceeds of which are payable into the consolidated fund as part of the revenues of Barbados. It is being insisted, it is being emphasized today that these monies collected as part of our national insurance contributions will not be paid into the consolidated fund, but will be paid into the national insurance fund intended for the operations of the QEH. You are a legal person, Mr. Speaker. I am not. I speak from the layman's perspective. There are more of us in Barbados than there are of you. And therefore, we need properly to be told whether or not this procedure is proper. Because taxes and levies collected at the hands of the citizens should go into the consolidated fund. Now, we are expressing the view that we want to ensure that these monies go directly to the Queen Elizabeth Hospital and that we do not have repeated instances of that which we've had in the past, where money is paid into the consolidated fund for some particularly identified person, some particular identified purpose did not so reach the intended target, but would have been used for other purposes. So we want to ensure, I am being made to understand, that when these funds are collected, since they're intended for the QEH, we're not putting them in the consolidated fund because we don't trust that mechanism. We're putting them, and we don't trust that mechanism in light of recent experiences. This is what I'm understanding. So we're putting these funds at the disposal of the National Insurance Board, but clearly intended for the QEH. Now, consolidated fund is part of the central government mechanism. The National Insurance Board is not part of central government mechanism. What I'm hearing, therefore, is that the government of Barbados is better able to ensure that an entity, which is not a central government entity, is better disposed to managing funds, which the central government related entity, the consolidated fund, is not able to properly manage. I think if that is a problem, we need to address it. Otherwise, then we're seeking to address it here by directing these funds to the QEH through the National Insurance Board, when in fact the laws of Barbados prescribe otherwise. Now, it also bothers me a bit in terms of the timelines related to what we are seeking to do here. Remember, Mr. Speaker, the Minister of Finance declared in the mini-budget of 11th June, I think it was, that this levy would be charged. under the law, the passage of 4 months should bring to a cessation any action which was consequent upon that declaration on June 11th. So if the Minister of Finance imposed a levy or tax on June 11, and if after 4 months under the law it has not been legislated for in the Parliament of Barbados, then it ceases to be a validly collected tax. Now we can come here and talk about National Insurance Amendment and National Insurance Validation and all of that. The substantive point I'm trying to make is that a government so equipped as this one must be able to do things in a better fashion than has been the case of recent experience in multiple times, as I have illustrated with reference to the Transport Board, the appointment of senators, and the issues relative to the investment of pensioners in government paper in Barbados. Now, Mr. Speaker, the provisional collection of taxes legislation also prescribes thus: any tax or increase in the rate of an existing tax which becomes payable pursuant to subsection 1 shall cease to be so payable if the appropriate enactment for the imposition of the tax or for increasing the rate of the existing tax is not made or passed within 4 months of the date on which the budgetary proposals are made in the House of Assembly. Further, under Section 4, Clause 2, any tax or increase in the rate of an existing tax which becomes payable pursuant to subsection 1 shall cease to be so payable if the bill is not passed by the House of Assembly within 4 months of the date on which it is introduced therein. And as I said, Mr. Speaker, I'm a layperson and not a lawyer, so if I'm wrong, your learned self or many of our parliamentary colleagues here would put me on the right path. I'm simply but substantively trying to suggest that there has been a little bit, more than a little bit, of a measure of bungling around the bringing of this legislation to validate what was pronounced by the Minister of Finance. I think it was on the 11th day of June in this chamber of this year. Now, this bill allows us to make some focus not only on the QEH as an institution, but also on the National Insurance Fund as an institution. And I want to make this point, that this government has to see, as it seeks to transform this country, has to make sure that in terms of our governance mechanisms, we offer to Barbados the best that is possible. And I believe a serious look has to be taken at the entity we call the National Insurance Board, now ably led by my friend and political next-door neighbor from St. Michael West Central. We have to look at the National Insurance Board. We have to look at the board of the Central Bank of Barbados. I think if we are to be honest, we have to say that the actions of the National Insurance Board in recent times and the actions of the Central Bank Board in Barbados should be held up to scrutiny and fall subject to serious question. We have questions as to how national insurance funds have been used under the last administration, but they could not have been so used or misused without the complicity or compliance of the board. We have issues with how central bank operations were conducted in terms of funding government's current expenditure, but that could not so have taken place without complicity of the principals there, compliance of the board. We have to ensure, in my humble opinion, that there's a greater level of independence attaching to the operations of both the National Insurance Board and the Board of Governors of the Central Bank of Barbados. Now, I know that my honourable friend from St. Michael West Central is a man of sound character, sound sense of judgment, and is not a yes man. And I know that as he chairs this board, if any pressure from any source attempts to be brought to bear upon the decisions of the board as led by him, it will not so easily go down as seems to have been the case in recent time in Barbados. That notwithstanding, that particular individual circumstance of his leadership, we must look at the wider picture and see how these boards are constructed, take the politics out of the situation, and ensure that there is a level of maturity and sense of responsibility that so obtains that these very critical institutions do not become agents of a government gone wild. I do not anticipate that of this government. I do not anticipate that of this government to ever have to say of it that a government gone wild. But in recent times, we seem to have come to the view that we have had a case in Barbados of government gone wild. And government gone wild, then...
Honourable Member for Christchurch, East Central.
Mr. Speaker, I rise on a point of order because if the Honourable Member for St. Michael West would have read the substantive legislation, he would be aware that there's already a section that makes provision, section 20, that makes provision for the health service contribution. And so therefore to infer that the government is in any way not doing anything that is on sound legal footing, sir, I think we must object very strenuously to it. The assertion, sir, is that we are collecting monies illegally. There's already a provision for a health service contribution in the Act, sir. And so therefore, this amendment, sir, just seeks to bring regularity and specifics to the dates for which the provision now becomes effective, and two, that the monies collected through the National Insurance Board will be directed to the QEH as opposed to the consolidated fund, which is what is currently in the Act, and we are making those amendments, sir. So therefore, I wish to have that matter clarified for the record, sir.
Point of order noted.
I wish Your Honour, the Honourable Member, good luck in persuading those who understand these things that he is on a sound footing and that there's no measure of, and I hate to use the word bungling, but that's a popular term, involved in this matter. I was trying to suggest, Mr. Speaker, beyond that, which I thought had passed 15 minutes ago, I was trying to suggest, Mr. Speaker, that in the wider arena of governance in Barbados, we have to make sure that if our view of recent past happenings is that the National Insurance Board was improperly manipulated by the administration of the day, if we hold that view, and that view seems to have had some currency with many, some in this honourable chamber, and if we hold the view that the central bank should not have facilitated the Ministry of Finance in some of its actions of recent past, then I'm saying in a wider frame, we have to address the issue of governance at that level to make sure the politics is out of the situation, that these boards are properly constructed by men and women of sound judgment, sound character, who will always put the interests of Barbados first, as expressing every confidence that the National Insurance Fund is now, National Insurance Board is now led and chaired by one of such sound character, of sound judgment, and I hope a choice like that could be replicated many times as if board is fully constituted, and that the same would apply to the the board of the Central Bank of Barbados, because it would seem that there are those who are still part of the makeup of these boards, who were, in our view and in the opinion of many, complicit in the recent past with those actions which necessarily did not concur with the interests of the wider Barbadian society. And these boards have been reconstituted, and we see in some instances the presence of the same principles. They may have shifted boards, they may have gone from one street to another, but they're still part of the setup and still responsible at a very high level for how the funds of this country are managed. Mr. Speaker, and I just wanted to, I think the board has to tell Barbadians in very clear terms and at soon time what is happening vis-a-vis the level of contributions relative to the expenditure levels of the fund. I mean, that is a reasonable question to be asked. There is concern across the Caribbean region, not only in Barbados, that the level of contributions is not keeping pace with the level of anticipated expenditure going forward. And in the absence of a recent actuarial review and report, and I should speak more so perhaps the report than review, maybe the review has been done, but the report has not been seen, at least not by these eyes. In the absence of that, Barbadians would want to know where is the fund vis-a-vis contributions as opposed to projected expenditure and so forth going forward. My understanding is that upward or around 70% of the funds of the national insurance had been invested in government paper. One questions the prudence attaching to that. One questions the financial prudence attaching to that. But maybe that bears relationship to the point that I was trying to make earlier in terms of the board's complicity for whatever reasons with the decisions and actions of the government of the day. And beyond that 70% or so, 75% investment in government paper, which is poorly rated and had been poorly rated for some time. My understanding further is that probably 95% of the national insurance funds invested are invested in domestic instruments in an economy which has been seriously under stress. One has to examine these things dispassionately without political partisan interests, because we're dealing with the future of Barbadians. We're dealing with the integrity which relates to these funds. These things are not criticisms of the government of the day. These things are simply intended to point to what is perceived by many in Barbados as real problems which we face at the governance level in Barbados. Now, my honourable colleague from Christchurch East Central said to us this day, things will get worse before they get better. Things will get worse before...
I think he said rougher. If we want to paraphrase, he said rougher.
Well, I apologize, but I thought I heard worse. But things
he said rougher.
Things will get rougher. I was sure I heard worse. But things will get rougher. I stand corrected by you, Mr. Speaker, before they get better in Barbados. I think I understood what he meant to be saying to us. And I think there's a level at which all of us accept the fact that things in Barbados will get worse before the day of better dawns. But I thought it was quite interesting that he should use that kind of phrasing when referring to the services provided at our premier medical health institution. And perhaps there's some realities there that I am not familiar with, but I don't want to have to ever have to interface as a patient with the medical staff up there and be told, look, in regards to your individual health, personal health, things will get worse before they get better. It is a sort of an irony, but I appreciate where the honourable member is coming from. And he's indicating to Barbados, we ask you to make this contribution as a measure of sacrifice, because we want to improve the service that is provided for you, for us, for all of us and our families through the QEH. But bear with us for a while, because even as you make this sacrifice today, things will get rougher before they get worse. And I think you've got to let people know what lies in store for them. And I think that is clearly what I heard. Things will get rougher. Mr. Speaker, a few things I would want to note relative to provision of finances for the QEH and our healthcare sector. The World Health Organization suggests that between 20 and 40% of funds or resources allocated to healthcare, between 20 and 40%, between 20 and 40% contributes to the level of wastage in the system, in the sector. In other words, between 20 and 40 cents in every dollar contributed to the health sector is wasted in various ways. And I challenge my honourable friend from Bridgetown, the city, and indeed a very honourable man in every sense of the word, and that has nothing to do with his presence in this chamber, but it has to do with the integrity which attaches to the person himself. And I'm sure, Mr. Speaker, that he will rise to the challenges with which he is confronted as the one leading that ministry and deal with these problems head on. And whereas we ask Barbadians to make the sacrifice and contribute additionally by way of taxation to healthcare services at the hospital, we've got as well to treat to the problems there which negate the impact and effect of that sacrifice. And if wastage is one, it is an area which has to be tackled. And in reading the WHO reports, it is suggested that a large component of that wastage revolves around the business of procurement. Procurement. Now we know that's a big problem in developing countries. We would be less than honest if we did not admit that the matter of procurement is a big problem. Procurement of public services is a big problem in Barbados. We shout very loudly to the world that it is one of the scars on the body of the last administration, that it was malpractice seemingly and lack of transparency and political partisanship and all the rest that goes with it, clientelism and all the rest that goes along with that, around the business of procurement of services for public operations. So if you are going to give to the QEH 2.5% as a sacrificial contribution from the hands and pockets of Barbadians, fine, but deal with wastage. And deal with wastage as it has to do with procurement. And that is something on which the Honourable Minister responsible, my honourable friend from the city, will have to get on top of the business of procurement and the wastage that is occasioned therein, and pilferage through you, Mr. Speaker. And I don't want to shout too loudly on that. I am not here to do that, simply to say that that is part of the reality that you want to address. You do not want to know, Mr. Speaker, that the bar of soap that you contribute by means of your sacrifice is not allowed to have the effect that it has, because somebody believes that the bar of soap better belongs at their home than at the QEH. And that's all I'm saying. I'm not here to try to put down Barbadians. I'm here to say that while we understand the sacrifice that we're being asked to make from time to time, we have to deal with the issues that negate those sacrifices. The Honourable Member for St. Thomas perhaps is the best heart and mouth in this honourable chamber to speak to those things, because she understands and expresses those things like nobody else I have ever heard, and I say that sincerely. And yes, and when she speaks on those matters, people listen, and I hope that I will have her support in that call for greater attention to be paid to this matter of procurement and pilferage, as they contribute to wastage, which impacts upon the level of sacrifice that you make, that I make, that all of us are being called upon to make. The Honourable Member for the City called for a higher quality of service from the institution and the professional staff there in light of the fact that they're getting this money. And I understand that call. If you're being better supported, if you're being better financed, then let's see an improvement in attitudes. I understood him to be saying that. And if that's his call, I have no quarrel with that. He's calling for better quality of service. And if he feels as the minister responsible that there's need to make a call upon the professionals in the institution to make that, if he feels it's his duty to make that call, I have no problem, no issue with that. But I would encourage the Honourable Minister and the member for the city also to realize that there's some issues beyond the lack of financing that the professional staff, particularly so nurses, and it's their plight I want to zero in perhaps more than anything else, they're facing at the QEH. My understanding is that sometimes you have a situation where there may be a ratio of one nurse on duty in a ward to over 20, 25 patients. I've never witnessed it myself, but talking to those who work as professionals in the institution, they're faced with a daily experience, they're faced with daily frustrations, and that is my understanding, that sometimes there's one nurse on duty in a ward, it's 20 to 25, and I was all right to say we're giving you more money, give us a better quality of service. But if it is 1 to 25 people who are ill, and when people are ill, they're not their best selves, and then that is a very trying situation for anybody. I understand sometimes rather than 20 persons allocated to some of the theaters, a complement of 20, you may go down to numbers like 8 or 9. And if you're operating in 2 shifts, let's say the obstetrics theater, you're down to 8 or 9 people, 2 shifts. That's 4 or 5 people who would normally form part of a complement of 20 or more. Now, one would speculate as to why there are, why you have these situations of low staff complement. And maybe it is a question of financing. Maybe it's a question of a government through this institution trying to wrestle with the shortage of funding to get on board the number of bodies you need to provide the quality of service that is required. And it is in that context, therefore, that I issue this next appeal and this next caution. And I do hope that with the bad seeming situation already existing with respect to shortage of nurses I'm talking about, that we are not going to see the job cuts initiative that this government has embarked upon in an effort to right the ship, as they have said, in an effort to make government fit for purpose, as they have said, but also in an effort to meet IMF imposed criteria and requirements. I hope that we do not have to see in a situation the QEH further denuded of the required staff complements, whether it be with respect to nurses or ancillary staff or any other type of staff. We're dealing with health care here. To quote the Honourable Member from the city, the health of the nation is the wealth of the nation. And as we try to right the ship, as we try to downsize in order to right size, we really ought to be careful how the scalpel is used with respect to the operations in the health sector. And you've got a situation where there's a shortage, particularly so for various reasons, of nursing staff. And you've got to make sure that these job cuts are not so gone about that the QEH, to the disadvantage of the Barbadian public, finds itself victim to this as well. You know, on the matter of job cuts, and I don't want to get into that today because this debate is not really a lot about that. But I keep hearing repeated by members, by persons who are not even members of this elected chamber. That is not about numbers. It's not about numbers. It's not about numbers. It's about targets. It's not about numbers. Now, how do you get those targets without taking into consideration the numbers? It's not about numbers. It's about right sizing. How do you right size without taking into consideration? You're right, it's not about numbers. It's about people. It's about people who have their mortgages to pay. It's about people who have their debt platforms that they have to service. And all of a sudden, without the realm of expectation, there comes this hand that cuts jobs. There comes this voice, these voices which say it's not about numbers. And I pray that the job cuts may not so negatively impact the operations of the Queen Elizabeth Hospital. There is a flight of nurses contributing to the shortage. I believe the Honourable Minister will be troubled by that. We train people in this field. We provide opportunities for training, which I'm told are sporadic, not as sustained and as consistent as they should be, not as thought through and structured as they ought to be, and therefore there are areas of training which are vital, which are not included sometimes in the training program, and it contributes to shortage in those areas. But there is a flight of nurses. There are people who are being enticed by those from the United States, and those from Canada, and those from the UK. And they're providing for our people what we right now are not in a position to provide. They're paying for their exams, they're paying for the visas, they're paying for their training, they're paying for whatever is necessary that it be paid for. And so we have this flight of nurses. In the midst of all of that, maybe we can't pay more for their training. Maybe we can't pay them more in terms of their remuneration, their salaries. Maybe we can't pay for a lot of things that these actors from abroad are offering. But I believe what lies within the realm of our capacity and our ability is to reduce the frustrations which contribute to that flight. If people flee or go because they want a better opportunity, if people go because this is a better situation financially, there's nothing you can do about that. But what we can do in order to minimize that prospect of flight is that we reduce the frustrations that they are facing from day to day. And I do not know if you or I, Mr. Speaker, would want or find ourselves having fallen ill under the hand of a medical professional who is frustrated. He may indeed, or she may indeed, take out their frustrations on us. But you can't have people serving in an industry of care and compassion who are beset by high levels of frustration. And that's all I'm saying. We need to take the frustration as far as we can out of the system, because perhaps that is something which we can control, Mr. Speaker. In that context, there's a high incidence of sick leave, I understand. And I'm not saying that people are staying home sick. That's not the story I got, that people are staying home sick because they're frustrated. stories I got suggest to me that people do in fact fall sick because of the frustration, because of the heavier workload, when there are shortages of staff and stuff like that. And these things can be addressed by us. A lot of these things don't require that we add money to the situation. A lot of these things require that we add management, quality management to the situation at hand. I am told, Mr. Speaker, that the polyclinics, as well intentioned as the government may be, to shift some of the services to the polyclinics and have extended opening hours at polyclinics. I am being told by persons to whom I speak that the polyclinics are not necessarily in a position to handle what they call the push out from the QEH in certain areas. So we got to be careful with that. Extended opening hours, additional services at the community level through the polyclinics, that's a good way to go once we're prepared for it. But it makes no sense telling people that Polyclinic A will be open for 24 hours and that we are going to be offering this service at the polyclinic if you don't have the proper staff, complement their nursing staff to deal with that service adequately. I'm being told.
Our member for the City of Bridgetown.
Point of elucidation, Mr. Speaker. Just want to impress upon the Honourable Leader of the Opposition the fact that the 2 polyclinics that are scheduled for the 24-hour service will also be equipped either directly or through contractual arrangements with private sector agencies to provide the level of diagnostic and radiological services that will be required to supplement the operations that we expect them to do.
And thank you for that elucidation. And when the Honourable member of the city gives his word, I take it, because he is indeed an honourable member. And so I take him at his word. But if he says that these things are going to be provided, or they are being provided, it means that he understands where I'm coming from when people who work in these institutions say that right now, at this particular point, we are not able to handle the push out from the QEH. So as you push out from the QEH, we need to ensure that what the honourable member just said is in fact in place, and that these polyclinics are provided with the adequate resources to address the issues with which they are faced. I'm told that part of the problem with nurses, through you to the Honourable Minister, is that staff nurses, senior nurses, are not often in a position to properly assist student nurses who are then positioned at the hospital as they go through their practice. Because of the shortage, because of the additional pressures, student nurses then assigned for practice are not properly and fully supervised, and that presents a level of frustration for the student nurse, for the senior nurse, and it presents an additional possible consequence, and negatively so, for the patients. And that is something that I would urge that the honourable member also give some attention to. Shortages of medication, these stories are legend, and I hope this money will help to address that. It cannot be that people can't have basic necessities and accessories in the hospital, and that day must come to an end. I laud the hospital staff, because I've heard from many a mouth that several of them do it in frequent instances where there's a shortage of this and there's a shortage of that, and the hospital staff pull their own pockets. Where nurses are doing that, where doctors are doing that, where ancillary staff is doing that, I laud them. I laud them. But this is not the way it should be, and I trust that this money will find its target, and that those who manage these resources will properly allocate them to points of need, so that these horror stories would become a thing of the past. I know that the Honourable member, to the extent that the ministerial regulations allow him to do, will bring his discipline, born of many years in the military, to bear on these situations to get things done and make sure that they happen, and that a lot of it is not just left to chance or happenstance. And then I want to put in a plug for the physiotherapy department, through you, Mr. Speaker. We hear a lot about the emergency room and all of that, and I'm happy to hear what I'm hearing, and I trust that it functions. Just one thing puzzled me a little, and I don't say this to be facetious. I say this because it puzzled me a little, and I will, in private conversation, ask the Honourable Minister, because he said, when you're first examined and you're considered not to be a serious case, then we send you to that not so serious clinic, yeah? And then you pointed to the possibility that you may in fact be admitted from that not so serious clinic. And that puzzled me a bit, because if at first examination I'm referred to the not so serious clinic, but then when I get there I'm hearing to be admitted, I'm wondering what's going down. So thank you.
I was merely stating, and I didn't use serious because serious has several connotations. But we're looking at acute care. And those, when you go to the accident and emergency and you are triage and you're not considered to be under that classification, then you are not given the preference over those persons who are, so that if an accident victim, gunshot wounds and so on come in, they will take precedence and then you have to wait. Although your situation may be serious in a sense, but not to the level that I'm speaking about, and then you'll be referred to the minor cases unit. That is what he said.
All right, Mr. Speaker, so you are in the minor cases unit and you don't anticipate that you'll be admitted from there. But I get what you're saying, and I thank you for the elucidation. The physiotherapy department, I've said this before elsewhere. I went there every day for about 2 years with a sister of mine who had need to go there. And then almost immediately upon her not having to go there because she went abroad, there is someone I know with whom I went there weekly for about a year. And I say that to applaud the staff in the physiotherapy department, and I really sincerely mean that. My sense is that there again was shortage. There's a shortage of staff. There's a shortage of equipment. There's a shortage of space. And if anyone is just slightly observant, you will see that there are now multiplied numbers of cases of people needing physiotherapy treatment at the QEH. So though we pay attention to the accident and emergency, and you have to do that, hallelujah, but the physiotherapy department, many people go there with different types of injuries, young and old, and stroke patients and all kinds of stuff. And the space is too confined, the equipment is too limited, but the staff has a great attitude from what I have seen, and I want to commend them for that, but I commend their interest to the Honourable Minister and invite that you take a look at it. And with that, I thank you.
Honourable Member for St. Michael West Central.
Thank you, Mr. Speaker. I too would like to join this debate and congratulate the Honourable Member for Christchurch East Central for introducing the bill this morning. He did so with clarity, and I think in the best interest of transparency, it is important that we recall that the introduction of the bill that is more about a health service contribution and not a health service levy. Mr. Speaker, I would also wish to congratulate the Honourable Member for the City, the Minister of Health, who must be complimented on the initiatives that he's commenced in respect of the improvement of the Queen Elizabeth Hospital. And he really deserves credit, Mr. Speaker, because when you look and you've seen over the last 10 years what would have gone wrong at the Queen Elizabeth Hospital, the initiatives that I heard this morning, when they're all implemented, I think we'll see a complete transformation of the Queen Elizabeth Hospital. And Minister, I want to say the constituents of St. Michael West Central will be grateful for your contributions in this area, and I thank you. Mr. Speaker, the Queen Elizabeth Hospital, and it goes without saying, it needs a financial injection, and there needs to be a capital expenditure program. But it's also true to say that the government cannot carry it alone. And therefore, the health service contribution is intended for all of us to make that contribution to the improvement of the Queen Elizabeth Hospital in order for us to sustain our world-renowned institution. You will recall, sir, that during the June 11th budget debate, and in the Prime Minister's presentation, Minister of Finance, the Honourable Member for St. Michael Northeast, made a commitment to a $3 million allocation of $3 million for the provision of 24-hour service at the Randall Phillips and the Sir Winston Scott polyclinics, and those are on the way, I'm told. And then the Minister of Finance even went further, and she made a further commitment of $11 million, not, and you have to take this into consideration where we are, of $11 million for the expansion of the A&E department. So those two initiatives, combined with the health service contribution, I think will go a long way in ensuring that we have a very stable, efficient, but improved Queen Elizabeth Hospital service. Mr. Speaker, the Leader of the Opposition obviously wanted to give me a wonderful platform to bat on this morning. But before I say that too, I would want to thank the Leader of the Opposition for his endorsement of me as the Chairman of the National Insurance Scheme, and for his very worthy comments of me. And I shall tell him that I will not let the country down, certainly will not let the constituents of St. Michael West Central down, and by extension, I will not let him down either. But Mr. Speaker, the Leader made some observations I think it would be worthy of us to respond to. The issue with respect to the national insurance, the health contribution, I want to put it on record that the National Insurance Scheme is responsible for managing not only the National Insurance Fund, but they're also responsible for managing several funds. For example, the Unemployment Benefit Fund, the Sugar Workers Provident Fund, the Catastrophe Fund, Mr. Speaker, the Retraining Fund, the Severance Payment Fund. Mr. Speaker, I can go on. So the health service contribution will be about one of those funds. And what will happen essentially? It is classified like a small fund. The funds will be paid over by the employers into the National Insurance Scheme. The National Insurance Scheme will become the facilitator and then pass that money over to the Queen Elizabeth Hospital so that they can get on with their job. So it's not, Mr. Speaker, a situation where I know in respect of the provisional collection of taxes are, but I want to make it clear that there is and there exists a number of funds intended to address key areas. And I thought I would just make that point. The second point, Mr. Speaker, is that there's no pressure on me, certainly as Chairman of the National Insurance Scheme, to take any actions. Of course, I report to the Prime Minister who is responsible for that fund. And certainly I can give the House the assurance this morning that the Prime Minister has never once pressured me or engaged me in any such dialogue in respect of the National Insurance Scheme. So I would want to let the Leader of the Opposition know that no pressure is being brought on me. The second point has to do with the issue of contributions versus expenditure, which the Leader of the Opposition made. But I would also suggest that you must not only look at contributions, we also have to look at investment income. And the National Insurance Scheme, yes, derives its income from contribution. It also derives its investment income as well, which helps to the overall impact of what we call overall revenue. But, Mr. Speaker, I'm going to speak, maybe if I get the opportunity, or quickly allude to it, that one of the reasons why the government of Barbados, this Barbados Labour Party government, had to take urgent actions is because you were in a situation, frankly, where the former government, the Democratic Labour Party government, was not in a position to do a lot of things that they're meant to do. And therefore, as a result, it may appear that they went well, but not this Barbados Labour Party government. If there's any insinuation that perhaps agents of government gone well, I would say, Mr. Speaker, that perhaps the Leader of the Opposition was referring, and rightly so, to the former government who would have said agents that would have gone well. But I can assure the House that under my leadership and certainly representing this Barbados Labour Party, that will not happen. And Mr. Speaker, it takes me on, and I will have to beg your indulgence in this respect, that sometimes you don't like to look back, but we have to, because the Democratic Labour Party government could not pay national insurance contribution for non-contributory pensioners, and a lot of people in Barbados don't know this, you know. It is the government of Barbados that has to repay the national insurance fund for the contributions paid to the non-contributory pensions in Barbados, and that the former government refused to pay millions of dollars to the national insurance scheme to facilitate the payment to the non-contributory pensioners in Barbados. Mr. Speaker, I go further. The former government also engaged in an exercise, Mr. Speaker, where they could not even pay rents for the buildings that they occupied, and amassed almost $500 million to the national insurance scheme. They were also engaged in actions, Mr. Speaker, where it was almost like you had to take the government paper. And as a result of taking the government paper, we are where we are today. Because they couldn't pay the national insurance, they couldn't pay the non-contributory pension, and as a direct result, you had a government of Barbados effectively defaulting on the national insurance scheme. And I want to talk about defaulting, and I can speak at some point in time to the president of that institution too, because there's a story to be told there. But they would want to give the people in Barbados the impression that we are doing something so wrong, but we aren't. But thankfully, and I can say with authority, that the government of Barbados paid its contributions for August 2018 to the National Insurance Board. To the National Insurance Scheme, Mr. Speaker. And I want that message to go forth, but I'm not going to waste a lot of time on the Democratic Labour Party. I'm not going to waste too much time on that, because, Mr. Speaker, one thing is clear. If we have a strong economy, it is best for a national insurance scheme. If we have a weak economy, it is bad for the national insurance scheme. And this government has taken swift action to ensure we manage and protect the national insurance scheme, but of course that we build a stronger Barbados economy. And Mr. Speaker, I want to talk about a couple initiatives. And it is important that we speak to some of these initiatives. The issue, sir, has to do with the fact that, and for the very reasons that the Leader of the Opposition would have alluded to, in terms of perhaps the former government going well, or agents of the former government going well, we have to protect the national insurance scheme. And one of the things that we are going to do to ensure that you never get too heavily involved in all this government paper is that we have to have a new investment code and guidelines, Mr. Speaker. And I can say to you that the last investment committee, we made a recommendation that we will have a new investment code and guidelines for the national insurance scheme. Because the time has come where we should never be in a position, no party coming to office should have to be in our position, where we now have to fix all these problems that were left behind, including the economy, Mr. Speaker. And that even though in opposition, the Barbados Labour Party would have warned the government of the day of the consequences of their actions, Mr. Speaker, they never listen to us. But when we have that new investment code, it will deal specifically with some of the issues as it relates to the investment, and particularly the investment in government paper. It is a fact, sir, that when the Democratic Labour Party left office, they left office with almost 70% of national insurance tied up in government paper. It is a fact. But a new investment code will direct that. It is important for us not to have all our money in government paper. It is critically important for us, Mr. Speaker, to ensure that we have a diverse portfolio, because it is important, especially when you're dealing with pension funds. And those of us who know about LO regulations and pensions, it is important that we have a safe and secure fund for the future. And notwithstanding the actions, Mr. Speaker, this Barbados Labour Party government has ensured that we are going to have national insurance on a strong footing, because we are going to have a strong economy. Mr. Speaker, I also want to speak about the customer service improvement strategy. It is a fact that there are several contributors to the national insurance scheme who depend on benefits, be it survivor's benefit, unemployment benefits, you name the list, Mr. Speaker. They depend on the national insurance scheme for benefits. And it's important that we give even more confidence to the insured population, because, you know, on occasion you have a lot of commentators who will come out there and will make a lot of loose remarks and try to give the impression that the national insurance scheme is not safe, it is weak, all these negative comments, Mr. Speaker. But if you speed up the provision of benefits to the insured persons, I think the people of Barbados will recognize that they have significant concerns. And Mr. Speaker, there is a backlog of claims, but we are working, and from the time I assumed chairmanship, I've made the point that we have got to work and work hard to ensure that we clear up those backlog of claims. And I give the House the assurance this morning, sir, this afternoon, that we are going to clear the backlog of claims sitting at the National Insurance Scheme. It has to be proactive, Mr. Speaker, and it has got to respond to its customers, the insured population. I also want to make the point, sir, and we are in discussions currently. At the last board meeting, we made the point that those persons who are laid off, instead of having to go to the National Insurance Scheme to register for unemployment benefits, then they have to leave Rock and go all the way to the Ministry of Labour for a stamp or for a counseling. Mr. Speaker, we took the decision to engage the Ministry of Labour to ensure we have a one-stop mechanism, so that when you go to the National Insurance to register for unemployment benefits, you will also be seen by a representative of the Ministry of Labour, and I hope very shortly to confirm that the commencement day of that program, we are going to find the space at the National Insurance Office to ensure we improve customer service. Mr. Speaker, I make the point, and I'll say it over and over again, the National Insurance Scheme is there to serve the people of Barbados. And this Barbados Labour Party will live up to that expectation, and certainly under my leadership. I also want, Mr. Speaker, to make a point, because there are some persons who have to rely on non-contributory pension. Sometimes not all through their fault, but on occasion, Mr. Speaker, because there is an absence of a mechanism to check, online that is, to check contributions. Sometimes people go to work, they work hard, and then when they go retired, they realize that they have insufficient contributions, the 500 contributions, in order to qualify for a contributory pension, and then they have to go into the non-contributory realm if they qualify, Mr. Speaker. But I want to make this point. As part of the initiatives that we intend to set up for the National Insurance Scheme, we have got to move to a stage where workers in Barbados who contribute to a National Insurance Scheme can go online and check and see how many contributions that they have. Because it is important. It perhaps sounds light, but when you have a situation If you know that the minimum contributions, that you must satisfy a minimum of 500 contributions for pension, and you know that you only have 300, but you perhaps work a place for several years and you should have more, it should be your right to go online, check, because it would take the pressure off the government of Barbados, because I made the point that the government of Barbados funds the non-contributory pension scheme in Barbados. It is the Treasury that has to pay it. And if we can sensitize people, and particularly the self-employed persons as well, and encourage them through new initiatives to check and to see how many contributions, it would ease the Treasury down the road, but it would create the self-awareness necessary to ensure. So that, Mr. Speaker, we have got to introduce our online scheme to allow insured persons to check their contributions. Mr. Speaker, those of us who are familiar with the United States system, you know you have a point system for Social Security. You go, you have to have 40 points to qualify for a pension, Social Security scheme. And at the end of the year, you can get an email or you could go online and check, Mr. Speaker, to see where you are. Mr. Speaker, I see no good reason why, with all the computerization that we have, that we cannot move to that situation. But I say to you that we are going to move to that situation. Mr. Speaker, the 15th actual review is published on the website, the National Insurance website, and is available for all to go and read. The 16th actual review is commenced already, and I am also pleased to say the actuary will be in Barbados this month to obviously meet with the board and also start the round of discussions. And that is necessary, Mr. Speaker, because we are open and transparent government. And one of the things, sir, that I think we have to do, and I'm going to recommend it to the Honourable Prime Minister, that when the actual review is finished, there's no good reason, sir, why we can't have a presentation to the social partnership and let them present to the social partnership. Because sometimes there's so much miscommunication. There's so much gossip, rumor, and innuendo about the fund that sometimes it really confuses Barbadians, and that is the point. But when you can't get your benefits in sufficient time, sometimes that lends to that credibility. So I'm saying to you, we have to go that route, and I will suggest it because we're open and transparent government. We will go that route, but we also have to work on resolving the issue of contributions. Mr. Speaker, I want to say that the National Insurance Scheme is sound. It is a good scheme. It is a scheme, perhaps, when you look across the region and across the world, it is a scheme that perhaps doesn't carry as many benefits. When you look at other schemes, sir, they certainly don't have as many benefits that as we do and we offer. And I really want to say that the National Insurance Scheme will go a long way to dealing with the issues that we have to deal with. And I also want to make the point that the importance of having a strong national insurance scheme is multiple-fold. But more importantly, sir, it is because we have a situation that if at any point in time the national insurance scheme can't make its obligation, in law, the government will have to meet them. But we are not there. We are far from there, Mr. Speaker. And what a lot of people don't know is that the National Insurance Fund is strong enough and it has the capacity to pay pensions many years down the road. But you must always have an actual review. You must also have checks and balances to ensure the fund remains where it stands. So, Mr. Speaker, I want to say to all Barbadians, the National Insurance Fund is there to serve the people. We've got to improve customer service, and we will improve customer service. We've got to improve the management of our portfolio, Mr. Speaker, and I've spoken to it. We've got to amend the guidelines. And I say to you, sir, and I say to this Honourable House, that the National Insurance Scheme will endeavour to do what it has to do to remain a very vibrant, strong and safe fund, Mr. Speaker. So that, in concluding, I want to reiterate my comments. But the one thing I would like to recommend to the Minister of Health, and I know that they are doing this already, but you have quite a few entities in Barbados who contribute to the Queen Elizabeth Hospital, who donate to the Queen Elizabeth Hospital. But sometimes I think perhaps we can find a more efficient way of getting contributions in, particularly from the philanthropists and so on. And I believe, sir, because I work for a company, and I can enter into record Elegant Hotels, Barbados Management Limited. And that company is associated with Transplant Links. And annually, sometimes twice a year actually, they come to Barbados. We provide accommodation for them at one of our resorts, and particularly Turtle Beach Resort. And we accommodate them. Full accommodation, rooms, everything, food, everything. And we do that because we recognize as a company and as part of our citizenship and civic responsibility to a country, we've got to do these things. And I would like to encourage many more Barbadian companies to do so, because it serves the interests of the Queen Elizabeth Hospital. But I also want to suggest that sometimes there are several entities abroad who are willing and able to give a contribution. In fact, there are many institutions, medical institutions in the United States, who, because they have to change out their equipment annually, because it's a business and sometimes they have to capitalize stuff, and sometimes very good equipment too. They are sanitized and they're shipped and they're sent elsewhere. But we have an opportunity there. And I really believe that we need to have a protocol, and perhaps we do have a protocol in place, where we can facilitate donations from United States, from Canada, from UK, and from other private donors who are willing to donate to the Queen Elizabeth Hospital. This country is fortunate in the sense that you have a number of repeat visitors who come here and who perhaps call here their second home, and who will contribute in many areas. And I think this is one area. But the complaint that I have heard of, and particularly from a Florida-based institution, is that sometimes to get the equipment here, it perhaps seems too bureaucratic. So I know we have to protect our borders and we have to protect customs, but perhaps if a new protocol arrangement could be put in place, I'm sure that this will go a long way in helping to give the Queen Elizabeth Hospital not only necessary injection of funds, but also equipment, and new equipment that we need, sir, in this part of the world. So I want to commend the Minister, the Honourable Member, Minister of Health, the Honourable Member for the City of Bridgetown, for his work thus far. There are exciting plans, and I want to say to him that the money is paid over to the collected in his name or in the name of his ministry on behalf of the National Insurance Scheme will be paid over by the 15th as required. So he has no problem about that. They will get the funds. And there's no cash flow problem that would disallow him or his institution from receiving the funds. So I want to commend the Minister on an outstanding job. The twinning of health and wellness, it goes a long way, and you can see the benefits of his ministry. And I'm pleased, Mr. Speaker, to stand here from the rear end and congratulate the Minister for what I consider to be a job well done. I also want to say to our colleagues that the road ahead perhaps will appear difficult. I know of weeping may endure for the night, but joy cometh in the morning, but I defer to the Bishop on that, the Honourable Member for St. Michael West. But I also want to say to Barbadians, this Barbados Labour Party took over, and we asked for the job, took over the management of the affairs of this country because we knew, and we've been saying for a long time, that the former administration was taking us on the wrong path. We've had to come in, sir. We've had to make some critical decisions. And I've said before that we must never be afraid or ashamed of having to restructure our debt. I said it in here in a presentation not so long ago, there are several companies here in Barbados and outside of Barbados that will go and restructure their debt and come out stronger and better. And I say to the people of Barbados as well, that the hand that we have been given, we are not going to play in the manner in which the former administration played. We are going to bring a sense of clarity and certainty to Barbados. We are going to manage the affairs, and you heard the Honourable Member for Christchurch East Central making the point in here time and time again. We have to fix it. It is our lot to fix. But this is not the first time that the Barbados Labour Party has been faced with this situation where we've had to fix the Barbados economy. But I say to the people of Barbados, as we have done in the past, we have inherited problems, we put our skills to work, our policies or our knowledge to help lift Barbados, and we lifted Barbados out of its circumstances. And I know, and I say to this country that I have confidence in my cabinet colleagues. I have confidence that they too will take Barbados from where it is today and make it a better place tomorrow. I mean, it seems, and a lot of people sometimes don't understand these things, that when you're faced with a government, there are several decisions you have to make. There are some people sometimes don't even understand the operations of a government. But one thing is certain, Mr. Speaker, is that we have the human capital on this side to help take Barbados from where it is. I call it the precipice of despair, and take it forward, Mr. Speaker. And I want to ask, as I did in the past, all Barbadians who reposed the confidence in us at the May 24th poll, I want to say to you that your government is working hard on your behalf, and that your government, this Barbados Labour Party government, will never let you down. Mr. Speaker, I am much obliged.
The Honourable Member for St. Philip North.
Thank you, Mr. Speaker. I could not avoid getting up today to speak, as I think I'm one of the only member in this present chamber who has first-hand experience working at the QEH, among the doctors and the nurses that everybody is talking about today. But before I get to the crux of the matter, I want to extend my condolences to the families of two of the stalwarts in medicine. That would be Mr. Vincent Clark in ENT and Dr. Livy Ford. They will be sorely missed, and I appreciate firsthand at least the contributions of Mr. Vincent Clark, who was one of my earliest teachers over 20 years ago. Recently, I was asked by a patient, what am I, a part-time politician or full-time doctor, or full-time politician or part-time doctor? And my reply was, it depends on the day. Well, this is the day, sir, that I can honestly say it would be 50-50% on each side. The amendment, and I salute the Honourable Member for Christchurch East Central, and of course the Minister of Health, Honourable Member for the City, on bringing it to this Honourable Chamber. I think it's long in coming. We all know that the Ministry of Health is not an easy one. This is, Honourable Member for the City, you will get licks from all ends, as the Bajans say. It is not an easy ministry, but you're off to a good start. Funny enough, my motto when I first opened my practice more than 20 years ago was the health of the family is the wealth of the family. It's on my letterhead, and I'm pleased to say it was extrapolated here to involve the whole country. Because we all know if the country is not well, everybody suffers. The productive time at work, the effective time at working hours will be at a loss there. Basically a drain on the economy. The only person that benefits from illness is really the undertaker in this circumstance. And I think the people of Barbados understand the levy, the tax being imposed. I for one understand, and I really believe that everybody needs to make a contribution towards it. And it's even better when you know where it's going. I think all our population needs to know in terms of taxes is that they can see their money working and they know where it is going. All of us receive health benefits, whether it's at birth, whether it's at death. We get to use the hospital, the polyclinics, the drug service. All of us at one point or other have had free, quote unquote, because somebody pays taxes, intervention from our healthcare services. But while I applaud the efforts of the ministry to expand the A&E department, and I have to agree here with the opposition leader, the hospital, we all know, needs a bit of work, a lot of work. And I can't help but say, a friend of mine told me the other day she's sick of hearing us blaming the DLP, the last administration, but it can't stop yet. You really cannot help. We really cannot help but lay the blame squarely or almost squarely on them. But the issues with the hospital is not only in terms of medical care. It starts from the minute you drive into the yard. The parking lot. I've had doctors call me and complain the parking lot is worse than our roads. When it gets flooded, you're in trouble. And then the walk from, old people can hardly manage from the parking lot to get to the entrance because of crime and so on. Several of the doors had to be closed. These are areas we need to really look at. The building, of course, and I've heard the Honourable Prime Minister allude to it, the building really needs a facelift, and we look forward to this money that from contributions being put towards this. It will be remiss of me not to bring some of the concerns of some of my colleagues who work in the hospital and outside of the hospital to basically let the public see where the monies would be directed. For instance, the surgical department. I had a complaint from a senior consultant, of course, that supplies are dwindling, equipment is dwindling. We now have a situation, I take it on good authority. We always knew that the waiting list for surgical procedures was long, but now I'm made to understand this morning, up to this morning, that the theater lists sometimes come every 2 weeks, which is unusual. We cannot have members of the public waiting for surgeries, all of which in my mind are serious. We cannot have members of the public continue in this vein for another a year, much less 5 years. The oncology department, and this is something that has been in our face recently with our honourable member St. Michael Southeast, with her illness. The oncology department, right now they're surviving on one oncologist. If he gets sick, if he goes on holiday, they're more or less in trouble. I am hoping that some of these monies go not only for the oncology, but to provide adequate staffing. Right now we are living on an antiquated, what you call a cobalt unit for the treatment of radiotherapy treatment for cancer patients. Antiquated means that if you have a tumor here, the beams are directed everywhere else, hence the side effects. Lung involvement, heart involvement with breast, for instance, breast cancers. There's a more modern linear unit that we need to get on board, and this is one of the things I would love to see us, linear accelerator is called, I would love to see us get to. I, like the opposition leader, applaud the physiotherapy department. Kudos to them for years. Funny enough, I left there 21 years ago, and I can't say that it has changed a whole lot. You cannot have patients with a broken leg or worse expecting to start physiotherapy 2 months after the injury. It is useless by this point. We have amputees that need it so that they could be ambulant. Barbados is one of the few places I see amputees relegated to the house. Other people travel all over the world. We stay down in the house shut in because you're not able to walk. Everybody can't afford a prosthesis. I understand the government helped in that case, but we need the physiotherapists to come on, not to come on board. We need more physiotherapy. We also need, and I agree, an expansion of the physiotherapy department. We need it badly. As I said, that was 20 years ago, and we're still stuck in the same place. Staffing is also an issue there. Wait times, appointments, ideally in most physiotherapy cases, you have at least 2 physiotherapy sessions a week. Sometimes you're lucky if you get 1 a month, and it's not a matter of staffing. The shortage of beds, yes, the A&E is overcrowded. I can attest to that. People are living down there. So I can only say I'm happy that that is in the works for expansion of the A&E department. The wards are full, yes, and it's true, sometimes you have one nurse looking after, especially at night, a ward of over 24 patients. And then we wonder about the frustration of the staff. As the Honourable Member for the Opposition says, it's hard not to become frustrated when 4 or 5 people calling for a bedpan at night. I have had to do it myself sometimes just to help out when it was there. All of these things the money needs to go to, and I want the public to understand that this is what we are fighting for. We have patients having to be discharged early. I have had amputees who had to come out the next day. This was unheard of when it was there, and you cannot blame the doctors, you need the beds. So apart from the any department, I am begging of you to make some preparation for expansion of the wards in not only the physical facility, but in terms of staffing. One of the issues with the last administration, when they hit the ground running, they came out early with it, is they basically made a mess of the drug service. We had issued drug service, and in terms of payment of the suppliers, there are many, well, I won't say many, there are few small suppliers of medication and drugs and so on that had to shut down because of the last administration. One of the biggest reasons is because the debts weren't being paid. Luckily, we have conscientious suppliers like Collins Limited who would still continue to supply and take a fraction of what is owed to them, and I really, really salute them today. But this kind of thing cannot happen. Again, not in any hurry. The drug service, I want to ask here, yes, we are moving to a generic formulary. Nothing wrong with that at face value, but the GPs, the doctors, the primary care physicians out there have an issue. Yes, we're moving to a generic formulary, but getting the generics is a battle. This is about more than 3 months that yes, we're moving to generic. Patients will have to pay for the brand names, but you cannot get the generics. We cannot have plans like this made, and I am begging here now that the primary care physicians be involved in the process. For too long we have been left out, and basically a country cannot function without primary care. Without good primary care, your hospitals will be inundated with patients, which means more money will be spent. So I'm asking that every now and then at least the drug service gives us a show, greets us, gets us in a meeting and see what we can offer. We are the ones out there that deal with these medications more so than the specialists. The specialists see the patients when they're far gone. And I think we are just as an important a member of the fraternity as the rest of them in the hospital, and I'm asking to be included there. I am glad that we now have a new Minister of Health. I take it on good authority. I had it on good authority that the last minister, well, we have more than one in that administration, different ones. We cannot have ministers to dabble in the affairs of the hospital, and I will explain what I mean. We had a situation with a group of interns last time when the minister, not saying which one it is, put himself in place to decide which interns got the job. This is foolishness. The only people that should be involved in that are the people that would have taught them, the consultants and the registrars and medical staff. And I'm happy to say that we do not have a minister like that this time around. And while I'm on internship, yes, we have, and I am going to put a plug for them when you begin the 24-hour service and the expansion. We have a few doctors out there, interns, that would have come out past internship that are not employed right now. They're living on, if a doctor goes on vacation or go away or something, they're living on that. Some of them work maybe 4 days a month if they're happy. Please remember, and I would love the specifics on how they're to apply for jobs in the system. There are also a few nurses that I know of. The Honourable Member for the Opposition alluded to that to the fact that nurses are leaving, but I know of a few that have actually come back home, have applied to get back jobs in the service and are finding difficulties. One I know has been here over a year and cannot get back into the system. Well-trained nurse that used to work at QE. So we need to get them on board again. I have issues with an intern, one of my constituents. I'm bringing it all here because this is my job. This is the politician part of me now. We have a doctor that would have trained in Canada, Barbadian, could not get a job training here. She went to Canada, qualified. Last administration, she only wants an internship post that she can go back to work in Canada. A job is waiting for her. All she has tried, she cannot get into the doors of the QEH to do internship. I'm going to speak to you about that privately. The polyclinics, yes, the 24-hour initiative, I love it. It was supposed to be there from the time I was working at the polyclinics. We're now seeing some sort of light at the end of the tunnel. That being said, you need trained people. I mean, the nurses that are there, many of them had come into and doctors have come into the polyclinic system to avoid the night work, to avoid the night duty, one. And two, once you have a 24-hour facility, you need trained practitioners, medical and nursing staff. You cannot expect the same kind of client in the day as you would at night. And you need trained personnel to do this. So in this case, I would say slow and steady wins the race. Let's do it well, let's do it properly, that the opposition leader will not accuse us of having to buy a dress and pull in the seams when you get home, which often happens. And we have to do a little give and take, opposition leader. We have to do a little, many times we buy a suit or a shirt in the store and come home and got to put a little dart. You know what I'm talking about. Have to put a little dart. Same thing happens with this administration. You need to give us a little break. We need to get the country back on track and almost, and of course he knows that. Of course he knows that. Of course he knows that. I am asking, I'm not on the board of the hospital, which is fine, but I'm asking for a little more attention to the nursing staff in that I have had on more than one occasion to ask for medical boarding for back injuries. Overseas, there's no such thing as lifting a patient, no such thing. All of the wards are fully equipped. There's no reason in 2018, 2019 that nurses should have to lift staff, whether it be bathing or dressings or to basically ambulate them to the bathroom. No reason at all. Put some of your money there. Protect our nurses. The nurses don't even know it, but they can run the hospital. They can ruin you. Yes, they can ruin you or make you better. Please make it better for them. Some other issues. I understand what the leader of the opposition was saying, but let me put a little bit of clarity for the minor cases here that I think I could probably do a better job than the Honourable Minister. There's a triage system. I think there's one now, but it needs to get better, and it will. Where if I come in with a suspicion of appendicitis, and the speaker comes in with a suspicion of just having ate something bad at the shop and a little bit of vomiting, I would be taken up as more serious. If he hurt his finger in the door slam or something, I would be taken a little more serious. He would probably be ferried off to the minor care. Chances are that you would not be admitted in a minor care setting, but things happen. You get patients that look well, I have had them too that could put you in trouble, look well at the outset and deteriorate. So I think it's a good thing. What I hope is that the triage system becomes better. With this, I can see the wait times at the hospital improving, which I am grateful for. It's hard as a doctor to, I've had many of my colleagues deal with it, send down a patient in the morning with a suspected heart attack, and they sit in the waiting room till afternoon till they fall over dead. I have had that experience. Those days need to be gone. So I applaud the efforts, I applaud the initiatives. I want to say that, and I had to make my contribution in terms of what I think, where I think the money should go. But of course, the people working at the hospital can do better than I can. So for now, something I forgot. There are many individuals out there who have medical insurance. Many who do not, but many who have medical insurance. And correct me if I'm wrong, I think it's on the books of the drug service as well as the hospital. Now, if you have insurance, you do not get the privilege of getting the medication under the drug service. I don't know how you will do it, but this needs to be instituted. The insurance companies, of course, have to pay their part. So I don't know how you're going to get patients to admit that they have insurance at the pharmacy level, but these are things that need to happen. So I can see in the future, in the near future, service, a medical service, a hospital service that is running like it should. We need to become the flagship of the Caribbean again. And we have been there before, and we can do it again. I can see staffing at the hospital. I can see patients going to A&E. And some of the money, I will plead with you now, should go to education. The problem with A&E department is that they see just as many colds, flus as the polyclinic, and this is not a place for the A&E department. So some of it needs to be spent on education of the public in terms of what should be seen in an emergency setting and what can be seen in the polyclinic and what can wait till tomorrow. We need to do that, educate the public. But I can see it working, I can see it running efficiently. I'm happy to pay the contribution myself. It's not always that you agree with taxation or taxes, but this is one that I was hoping that it would come soon, and you have not disappointed. Once again, I want to support the initiative, and I thank you, Mr. Speaker.
Honourable Member for Christchurch East Central.
Mr. Speaker, I want to thank my colleagues for their various contributions to this debate, and I'm certainly appreciated the intervention of the member for St. Philip North, because when I spoke to the need for us to do a public expenditure review, I think the member for St. Philip North articulated in her presentation precisely the areas where we need to concentrate and certainly allocate resources such that the quality of care that we are being able to offer, not just in the Queen Elizabeth Hospital, but certainly across the health sector in Barbados, can be improved. And one of the things that certainly we have been trying to do, and I say we as government, is to broaden the scope for consultation. And I'm sure that the Honourable Minister for the city and responsible for health would have heard the submission from the member for St. Philip North, because the reality, sir, is that we are in this together, and where monies can be spent better to deliver better service for the people of Barbados, I want really truly to thank the member for St. Philip North for her intervention. It speaks to intimate knowledge of the system, and certainly as we have read some of the reports coming to Cabinet from the ministry, it certainly validates the information that we have received. And now as we seek to move forward, sir, with the improvement of the provision of these services, then we will be engaging obviously all practitioners and stakeholders with respect to being able to improve the quality of service. And sir, I wish to just reiterate to the public of Barbados that there is already the provision for the health service contribution within the National Insurance and Social Security Act. It was previously appealed by by a previous Barbados Labour Party government, and so therefore suspended, and so therefore the need for new legislation is a moot point because it's still on the books. We are just reintroducing that element here. And so therefore, the fact that we made the announcement in the budget of June 11th, sir, this year, made reference, sir, to the fact that, at least it would have been articulated, sir, that it is already on the books, and therefore this amendment is just to seek to reactivate that specific provision. And sir, it is important to also, and I want to thank the member for St. Michael West Central for his intervention as well, because it is important for the public to recognize that the National Insurance Board does not only manage the pension funds, but we all know of the whether it's the severance fund, the unemployment fund, which the member articulated. And so therefore this is a process that allows for the cleanest way, sir, that we know of, for us to be able to get these monies to the Queen Elizabeth Hospital in a timely and efficient manner. Now, that is not to say, sir, as we are going about this process with respect to the way that the government of Barbados is seeking to stabilize the economy, that to give the QEH a measure of certainty, given that the provision is already there with respect to the national insurance, that we know, sir, that yes, revenues come in to the consolidated fund. But the reality is, sir, is that we have introduced over the years other measures where the funds received or monies collected do not come to the directly into the consolidated fund, simply because, sir, of the structure and the nature of the things that are asking to be delivered. And as we know, sir, we have gone through a very tough summer where within the Ministry of Finance we have had to make some serious decisions with respect to the process through which we have been releasing funds, because discipline, sir, requires that you understand and you undergo a change in the way that you do things. And so therefore, given that we are not in the business of doing that which was done before, when we say that we are going to do something, sir, we are going to make those resources directly available to be able to do that. And so there's nothing, I want to assure the public that there's nothing at all sinister about having the health service contribution collected through the national insurance scheme and paid directly to the Queen Elizabeth Hospital, sir, simply because it allows for a level of efficiency with respect to the QEH being able to execute its mandate. And I certainly want to give the public the assurance, sir, that this allows for a measure of transparency to be conducted, because in the past, sir, they were asked to pay taxes, but then somehow or the other, sir, the taxes went somewhere else. And we are not in the business of that, sir. Now, sir, there's a lot of work to be done. We know that. But as we seek to do that work, sir, and I refer to the intervention for the member for St. Philip North again, it is heartening to know, sir, that we have not just members in this place, but as we have engaged the public, sir, there are a lot of people out there who want to help improve the situation in Barbados. The government is taking the responsibility for making those resources available. And sir, through you, we will ask that persons who have ideas, as we've done in the past, that we make the appropriate representations to the various agencies or ministries so that we can have the opportunity to engage persons, sir, to seek to improve what we are doing in government. And I think one of the most important elements, sir, as we see in the context of modernizing government, and I know that it hasn't been spoken of in this place specifically today, there's an aspect of digitizing our medical records, sir, that is going to be very critical to how we improve the delivery of services in this country. So whether you go to your private doctor, or you go to a polyclinic, or you go to the hospital, sir, there needs to be a regime put in place that whatever physician you present yourself to, sir, that there's an element where that physician has, at some point in the future, to be able to see your health record in a way that does not in any way, sir, jeopardize anyone's privacy. But in order for us to be able to do that, sir, we have to make sure we are doing the things internally, changing our structures, our procedures, to make sure that that can happen. And sir, I believe, like as a member for St. Philip North would have indicated, these are some of those critical things, sir, that would allow us not just to understand how we are spending money, but would allow primary care physicians, nurses, and those who are involved in actually delivering those services, sir, to be able to make the best judgment as to what the treatment for patients should be, given a totality of your medical record being made available once you present yourself to any public health facility. And I think that should be emphasized, sir, as an area that we are going to be concentrating on, certainly over the next few years, to make sure that we are able to harmonize and integrate medical records across this land as part of our strategy for being able to improve the delivery of public services, public health services to the citizens. Sir, there are going to be substantive discussion on many of these issues, but today this is really just about making sure that when the monies are being collected from next month, and I just want to make it abundantly clear, sir, that in the situation with respect to when this levy comes into effect. In June, in the budget, the Prime Minister indicated, sir, that this measure will come into effect October 1st. I indicated that based on how the national insurance works, which I will repeat for the benefit of those who may be unaware. The 15th of every month, employers are expected to pay contributions for the prior month. So on the 15th of November, the 15th of November, employers will be expected to pay into the national insurance those contributions for October of 2018. And so therefore my reference earlier, sir, to November was simply to indicate that when those monies are due to be paid based on October's, your October's payroll, that when you pay those monies, this bill is simply to be able to allow for that legal footing for that to be done. There are persons who are paid weekly, there are persons who are paid bi-monthly, there are persons who are paid weekly, fortnightly, and on a monthly basis, sir. Those monies are due to be paid into the national insurance by the 15th of November, and going forward, that will continue in the normal way that it normally is done in the national insurance system. But the fact that it is effective October 1st means that any earnings that you have made since October 1st, sir, of 2018 are now subject to this health service contribution. And I hope, sir, that that is clear for yourself and those in and outside of this chamber, because this is important, sir, because this validation bill allows us then obviously to move forward in a situation where persons will know that when they pay those monies to the national insurance by the 15th of next month, and thereafter, that those monies will be deposited directly to the Queen Elizabeth Hospital rather than it coming into the consolidated fund and then somehow or the other finding its way somewhere else. That wouldn't happen under this administration. But we want to make sure, sir, that we've put the things in place, because at some point in the future, sir, the people may change their mind, but those things must still continue. And I think it's important that we send that signal to the country right now. Sir, this, in addition to that, I want to also indicate to the country that moving forward, we want to, where possible, absolutely make it clear whether it is the health service contribution, whether it's the garbage and sewage contribution, whether it is the airport levy, or any other measure of whether it's taxation or fees that are introduced, that the public not only just sees the revenues or the contributions being collected, but certainly to the extent that the improvements in service that they're meant to be able to do, that the institutions themselves, sir, will undergo a certain level of not just scrutiny, but certainly being able to improve the management of the affairs within those institutions charged with the responsibilities of executing their mandates based on these different types of funding arrangements. And that is going to be critical, sir, because the Ministry of Finance, sir, is not in the business of micromanaging. But we now have to make sure that the managers, the financial managers within these institutions, or the various boards of management, directors within these institutions, that they are equipped, sir, not just to understand what is the policy mandate of the government, but what are the financial requirements, sir, in order to be able to execute those mandates. And we are working, sir, to make sure that we put the necessary provisions in place to allow these, not just the financial managers, but the boards, to be able to execute their mandates. And so, sir, with those few words, I wish to beg that you do not leave the chair and the House resolve itself into committee. Oh, sorry. My apologies. Sorry. I beg to move that the bill be read a second time. Sorry.
Seconded, Mr. Speaker.
Sorry.
Question is that this bill be read a second time. All those honourable members in favour, please say aye. Aye. Those against, please say no. You think the ayes have it?
Mr. Speaker, I beg to move that you do not leave the chair and the House resolve itself into committee for further consideration of this bill.
Seconded.
Question is that the Speaker don't leave the chair and the House resolve itself into committee for further consideration of this bill. All those honourable members in favour, please say aye. Aye. Those against, please say no. We think the ayes have it.
This House is now in committee.
Madam Chair, I beg to move that Clause 1 stand part.
Second, please.
Question is that Clause 1 stand part. All honourable members in favour, please say aye. All honourable members against, please say no. Methinks the ayes have it.
Clause 2.
Madam Chair, I beg to move that Clause 2 stand part.
Question is that Clause 2 stand part. All honourable members in favour, please say aye. Aye. All honourable members against, please say no. Methinks the ayes have it.
Clause 3.
Madam Chair, I beg to move that Clause 3 stand part.
Question is that Clause 3 stand part. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Clause 4.
Madam Chair, I beg to move that Clause 4 stand part.
Question is that Clause 4 stand part. All honourable members in favour, please say aye. Aye. All honourable members against, please say nay. Methinks the ayes have it.
Clause 5.
Madam Chair, I beg to move that Clause 5 stand part.
Question is that Clause 5 stand part. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Clause 6.
Madam Chair, I beg to move that Clause 6 stand part.
Question is that Clause 6 stand part. All honourable members in favour, please say aye. Aye. All honourable members against, please say nay. Methinks the ayes have it.
Schedule.
Madam Chair, I beg to move that the schedule be the schedule to the bill.
Question is that the schedule be the schedule to the bill. All honourable members in favour, please say aye. Aye. All honourable members against, please say no. Methinks the ayes have it.
Report passing.
Madam Chair, I beg to move that you do not report to His Honour the Speaker the passing of one bill in committee.
question is, I now report to the Speaker the passing of one bill in committee. All honourable members in favour, please say aye. Aye. All honourable members against, please say nay. Methinks the ayes have it.
The chairman of committees has reported to me the passing of one bill in committee.
To move that the bill be not read a third time.
Question is that the bill be read a third time. Those honourable members in favour, please say aye. Aye. Those against, please say no. We think the ayes have it.
Yeah. Mr. Speaker, I beg to move that this bill be now passed and cited as the National Insurance and Social Security Amendment and Validation Act 2018.
Question is that the aforementioned bill be now cited, so cited and passed. All those honourable members, please say aye. Aye. Those against, please say no. We think the ayes have it. The aforementioned bill is so cited and passed.
Mr. Speaker, sir, I beg to move that these proceedings be suspended until 2:45 today.
Seconded, sir.
Question is that this honourable chamber be suspended until 2:45 in the PM. All those honourable members in favour, please say aye. Those against, please say no. I think the ayes have it. This honourable chamber is suspended until 2:45 in the PM.